Good afternoon. I thank all of you who are joining us virtually for this, the last town hall here at UAMS for calendar year 2020. We've gotten so much positive feedback about these town halls that we plan to continue this format going forward into the new year to share information with all of you, our members of Team UAMS. I wish that you could all be here in the auditorium as we normally do, but at this time that is still not safe. And we as healthcare providers here in the state of Arkansas know as well as anyone the perils that we face because of the COVID-19 pandemic. We still have, sadly, our nurses, physicians, and other healthcare providers who sit at the bedside holding the hands of people who are passing away from the coronavirus. There's promising news about vaccines that may soon be available, but we all know that it will take months before those vaccines are available to everyone who needs them. And in the meantime, it's critically important that we as members of Team UAMS continue to be role models, both here at work and in the community, demonstrating the best practices of wearing masks, social distancing, and good hand hygiene. Now, in addition to that, we know that large gatherings are places where the virus is particularly likely to be transmitted, and travel can exacerbate those challenges. Because of that, and in spite of the fact that we have the Christmas holiday coming up, I have asked my senior leadership team and leadership across UAMS to make a pledge not to travel over the holidays and to remain available in the event that the surge continues to progress, as is unfortunately predicted by the Bozeman College of Public Health models that you'll hear more about later on in this town hall. I would like to ask each of you to also make the same pledge not to travel over the holiday season. I know it's difficult, but it's definitely the right thing to do given the circumstances. As part of our work across the state, we have joined forces with the Arkansas Department of Health and the Governor's Office to make sure that we are raising awareness about the power that we all have to fight COVID-19. You may have seen ads either in social media or in other outlets on television featuring one of our team members, Barbara McDonald, one of our nurse practitioners, and I'd like to play that spot for you now.
There's a lot that we don't know about the complications from COVID. You can have no symptoms to the point where you have patients that go to the hospital and ultimately end up dying, and they seem to be stable and then they die. But what we do know is that wearing a mask protects you and others from COVID.
You have the power to protect yourself, your loved ones, and ensure a healthy economy when you wear a mask.
I want to thank the Arkansas Department of Health, the Governor's Office, and especially Barbara McDonald for doing such a terrific job of sharing important public health information to the people in the state of Arkansas. On another note, we have the UAMS holiday celebration. This will be the third year that we have had this celebration, and because of COVID-19, we've had to adjust our plans. We will provide meals for all of our team members, regardless of where you work or what time you work. They're delicious meals prepared by our nutrition services team, and they'll be grab and go so that we can do this in a safe way. In addition to that, we will have online opportunities for caroling and trivia. We'd love for you to participate with that through Zoom features. And we're going to have an ugly holiday mask contest. So if you've got a particularly shocking holiday mask, take a picture, post it to social media, Instagram, Facebook, Twitter, hashtag MaskUpUAMS. and who knows, you may win a cool prize. Now, let's get started. Today, Dr. Stepi Mehta, the CEO of the UAMS Medical Center, will give us a clinical update. Christina Clark, who's our Chief Operating Officer, will talk about revisions to our dress code policy, and will also give us an update on the Pine Cedar project, which is moving forward very rapidly. Our Chief Finance Officer, Amanda George, will update us on our finances. And finally, the Dean of the College of Public Health, Dr. Mark Williams, will give us an update on the college's projections for COVID-19 in the short, intermediate, and long term. Before I turn it over to Dr. Mehta, remember that when we finish our presentations, you'll have the opportunity to ask questions. We'll do the best that we can to answer all of them. If we don't get to them, we'll find other ways to answer your questions. So go ahead and start thinking about those now. And with that, I'd like to turn things over to Dr. Mehta.
Thank you, Cam, and good afternoon, everyone. I'd like to spend just a few minutes giving you an update of where UAMS is in its ability to take care of COVID patients, where we've been, where we are, and where we might be heading. So the first thing that I think bears stating unequivocally is that for the past 9 months, UAMS has risen to the occasion by being able to treat and take care of well every patient that has asked for help at UAMS. We have cared for and discharged over 800 patients from our inpatient units. We have cared for thousands of patients with COVID-19 who never required hospitalization. We have screened over 100,000. We have tested tens of thousands. And most importantly, we have adapted and become agile in accommodating the new conditions on the ground. This is nothing short of remarkable, I think, in the evolution of an organization. But of course, this is what we expect of ourselves because that's who we are. And in that light, I need to personally thank all those who have put in countless hours and a lot of blood, sweat, and tears to make all this possible. Most of all, the frontline staff who take care of these very sick patients every day. So just to put everything into perspective, yesterday there were, I think, 1,400 new cases of COVID in the state. We're ranging somewhere between 1,200 and 2,400 new cases every day. 1,000 of those are hospitalized in Arkansas hospitals. Our overall capacity to take care of patients, any patient requiring hospitalization in Arkansas, is starting to be challenged, with our hospitals being over 90% full, our ICUs being about 94% full. And when you look at the Little Rock area, we're looking more like 95 to 98% capacity in our ICUs. 54 of those patients are hospitalized at UAMS this morning. We reached an all-time high of 60 last weekend. 17 of those are in ICUs. We continue to do well with decreased mortality because of the superb care and the experience that our clinicians have gained over the last several months. We're in pretty good shape overall. Even though we are running up against capacity issues, we do have the ability to flex. So we have already opened up 12 new ICU beds on F4 for a total now of 56 ICU beds. We can expand beyond that to over 100 ICU beds. We've expanded our ventilator capacity from about 58 to 96. So we have an excess capacity currently for adult ventilation. We have adequate PPE supplies, everything that you might want for PPEs. We have more than enough for right now, and I am encouraged and confident in Curtis Broughton's ability to procure the equipment that we need. So we're not where we were in April or May. we have more than enough medications, whether it's dexamethasone or remdesivir. We now have the ability to infuse bamlanivimab. We started that yesterday. We have a new outpatient infusion clinic in our family medical center. So remember that the indication for that under the emergency use authorization is high-risk individuals who have mild to moderate disease and not hospitalized. So those infusions began yesterday. And as Dr. Patterson mentioned, we are poised to obtain the first allocation of vaccination a little bit later this month. A committee is working to create the prioritization schema. It will follow very closely what the CDC is recommending and our own Department of Health is recommending. Of those healthcare workers that are on the front line or anywhere close to being essential within our healthcare organizations will have highest priority, as well as those in skilled nursing facilities. That will be the first tranche or the first slice of individuals getting vaccination. We have adequate number of supplies for PCR testing, not what we would want. There continues to be a national shortfall of reagents for PCR testing. That's true across the U.S. We have enough to do the work that we have to do here on campus, and we have pretty good resources for reference labs that we send our tests out to. So we have many different platforms, 5 in-house and a number of reference labs that we rely on. We are working with the Department of Health to see about the feasibility of doing in-house point-of-care antigen testing once a week for all of our clinical employees, all of our employees who are on the front lines, also including EVS staff and transporters. There are some logistical problems that we have to work out to make this possible, but we think that we'll be able to do that. In addition to the ICU beds that I mentioned, we have reopened H9 and F9 as COVID units, so the surgical patients cared for up there now have been moved or are in the process of being moved. We are still using single occupancy of those rooms, but if we need to, we will double up and create semi-private rooms, doubling our capacity in those units. So I think you can see that we have done a lot. We have the capacity to take on more patients. My biggest concern is the most precious resource that we have, and that is all of you, those that work here on the front lines. Nobody is immune from getting COVID-19. Nobody is immune from getting sick for other reasons. And we all worry about burnout and just overall fatigue given the marathon that we've been on. However, I remain confident that we are a resilient bunch. We have strategies for stretching out our staffing if we need to do so. We will get through this, and during the question and answer session, I'm happy to entertain any question. Thanks, Cam.
Thank you very much, and I want to personally reiterate the thanks and admiration that Dr. Mehta shared for our frontline caregivers, whether you are a nurse, a physician, a tech, whether you help to keep our rooms safe and clean, whether you help to move patients from one part of our facility to another. You're doing incredible work, and we are deeply appreciative of everything that you do. Now I'd like to ask Ms. Christina Clark, our Chief Operating Officer, to give us an update on revisions to our dress code and to tell us about what's going on Pine Cedar.
Good afternoon. So we've had a teamwork over the last several months to combine the UAMS institution policy on dress code with the clinical policy. This policy will go into effect January 1st. And one of the things of note is that we will be allowing jeans under certain guidelines. However, those jeans are only allowed to be worn in non-clinical areas. Our communication team has put together a great video to demonstrate this change in policy, and so now we're going to go to the video. Okay, so now on to the energy project in Pine Cedar update. This picture was taken yesterday, midday. The energy plant is making great progress. We received the first generator on Monday, November 30th. The rest of the generators will be here by the end of the month. The rest of this is great news because we were concerned because of COVID that we were going to have a delay in those generators. Once the roof deck is installed on this building, the south building will begin. We are now starting to track the actual energy savings, knowing that we will not get the majority until after this energy plant is online. So along with the energy project is we've been doing a lighting upgrade since the last year. And as you can see from this chart, we have some areas that are completed with 100%. On average, we've got about 70% completed. We will probably have to delay the upgrade within the hospital due to our current census. The fitness court is now installed and is available for use by our employees. It will be publicly open to the community after the completion of the Pine Cedar project. It includes more than 30 pieces of body weight equipment with which users can get a full body workout. It is designed to be accessible by people of any fitness level for a fast, thorough workout. The court includes 7 different zones, each meant to target different muscle groups. Each zone can be used for more than one body weight exercise, depending on the desired difficulty. So each user can tailor a workout to his or her specific fitness level. I hope everyone enjoys the new fitness court. The work has begun to align Cedar. It started closest to I-630 and is moving toward Plateau. As you can see from the picture to the left, the picture to the right is the work to install the retention pond which will collect stormwater, which is on the east side of Lot 6, so between 6th Street and Capitol. The picture on the right shows the massive earthwork for the retention pond. A temporary change in traffic patterns are scheduled for a lane change beginning December 21st on Capitol between the existing Pine and Cedar. Lastly, as many of you know, Plateau has been closed since the beginning of this project and will be closed throughout. Sorry, I lost my track. In order to get to campus, some individuals have been cutting through the Walgreens parking lot, in some cases at a high rate of speed. This creates a very dangerous situation, so we ask that you please do not cut through this parking lot. And with that, hand it over.
Thank you very much, Ms. Clark. And I also want to thank the marketing and communications team for the great video that highlights the changes in our attire policy. So thanks to everybody who participated in providing the updates for that, and also thanks to the marketing and communication team for helping us to get the word out. Now, Amanda George, our Chief Finance Officer, will give us an update on UAMS finances.
Good afternoon, everyone. I will start by showing you an update of our current key clinical volume indicators through October 31. So far through the fiscal year, compared to budget, we are above where we budgeted in nearly every indicator. If you see total inpatient discharges, we're 6.2% above. Clinic visits are actually a little bit down. That hasn't rebounded as much as some of the others have. ED visits is up 5.5%, and surgical cases compared to budget is up 12.1%. If you remember, when we set our budget for fiscal 21, we assumed that we would experience the same suppressed volumes that we were seeing around the March, April, May timeframe. So we lowered our projections for the first quarter of fiscal year 21. So that's why we're seeing such a positive variance compared to budget. If you look at the comparison to the prior year, however, you'll see that we are down compared to where we were this time last year. So we've came back, but we haven't rebounded all the way yet. Inpatient discharges are still down 5.5%. Clinic visits are down 14.3%. ED visits 12.3%, and surgical cases 7.1%. One thing I will say about surgical cases, while in total they're down, when you break it out between inpatient and outpatient, inpatient is actually up. It's the outpatient cases where we're seeing the decline. Also on the screen, you'll see the COVID screening visits that we've done year to date. We've done 32,000 drive-through screening visits so far this fiscal year. This next slide shows you our financial income statement through 10/31 as well. If you look to the bottom line, we have performed very stably so far this fiscal year. We have an increase in net position of $15.6 million compared to a budgeted loss of $32.7 million. Again, because we predicted that the first quarter would be much lower and in line with what we were experiencing during the height of the pandemic. So we have a 48.4% variance compared to budget. And we're actually doing pretty well compared to prior year too. So this time prior year, we had a positive margin of $11.9 million. But the biggest indicator there, if there's a line right under the operating income or loss for the CARES Act money. So far this fiscal year, we've received $18.3 million from the CARES Act. So if you back that out, we would have had close to a loss of about $3 million. So it's still much better than where we thought we would be, but still not out of the woods just yet. So I think we need to continue to be very diligent and good stewards of our resources to maintain financial stability for the remainder of the fiscal year.
Thank you very much, Ms. George. I appreciate everybody's work in making sure that we are good stewards of the financial resources that we have so that we can continue to fulfill our obligation to the state to perform research, to teach, and to provide excellent clinical care. And so far, we've been able to continue to do that through all of your hard work, so we appreciate that. Now we have Dr. Mark Williams, the Dean of the Bozeman College of Public Health, who's going to give an update on behalf of the team that has been doing COVID-19 projections for the state of Arkansas. Dr. Williams.
Thank you, Chancellor. Good afternoon, everyone. I have just 3 content slides that I'm going to present today, and I'm afraid they contain some fairly daunting statistics. The forecast number of cumulative COVID-19 cases for December 14th in Arkansas is shown on this slide. The 15-day model is forecasting we will reach a cumulative 180,542 COVID-19 cases by the 14th. This is an increase of 24,295 cases, or 15% over what was reported to the state on Sunday, November 29th. To put this in perspective, in the next 2 weeks, we will equal the number of reported COVID-19 cases as was recorded by the state between March 11th and July 4th. This slide shows the 15-day forecast for COVID-19 hospitalizations in the state on December 14th. The 15-day model forecasts there will be 9,756 cumulative hospitalizations by the 14th due to COVID-19 disease. This is an increase of 913 hospitalizations, or 10% over the number on November 29th. To put this in some perspective, the number of hospitalizations in the next 2 weeks will equal the number of hospitalizations through June 6th. For the next month, for the last month, hospitalizations have been increasing roughly 10% every 2 weeks. If they were to continue in this strictly linear pattern, we can expect between January 13th and January 28th, 1,214 new hospitalizations. However, that's an incredibly conservative estimate, as the growth pattern is not linear, it's exponential. The 15-day model is forecasting a cumulative 2,709 deaths in Arkansas due to COVID-19 by December 14th. This is an increase of 239 deaths, or 10% over the deaths reported on the 29th of November. At the beginning of the pandemic in Arkansas, it took 4 months to experience this number of deaths from COVID-19, and we will see that number in the next 2 weeks. So what's the takeaway from the statistics shown on these 3 slides? Our conclusion in the college is that COVID-19 in Arkansas has entered a period of community spread. What this means, using a forest fire analogy, is that the fire in Arkansas up to mid-November was basically smoldering. Since mid-November, the fire's built up enough energy to begin burning through the forest. It will continue burning out of control, increasing in speed until there's no fuel left or someone comes along to put the fire out. The good news, of course, is that the fire department is on the way. The bad news is that the fire department won't get here until the end of March, or perhaps the beginning of April at the earliest. Until then, we're entering a bleak time, a time that will test our healthcare system in the state, and a time when we need all to be diligent. What matters now is what each one of us does to tamp down the fire that's raging in the state. Thank you.
Thank you, Dr. Williams. It's a sobering report, but it's a report that we need to take at face value. These will be difficult months for all of us. The options for us are to continue on the trajectory that we are on, hoping that the vaccines will be widely available and will be as effective and safe as promised. But as we began the session with, we do have the power to make change. And if we are not leaders within the community in demonstrating the power of masking, the power of social distancing, the power of good hand hygiene, and avoiding gatherings, whether they are large or small, with people who are not part of your nuclear family, we are going to be in a situation in which our healthcare system is not only strained, but in parts of the state, we will outstrip our ability to manage patients effectively and safely, whether they are COVID-19 positive or if they simply have problems that existed before COVID-19 came along, like heart disease, stroke, diabetes. So it's up to us to make a difference, and we do have the power. Now it's time for us to turn the meeting over to you. We ask you to ask questions. No question is out of bounds, and I'll ask Amy Jo Jenkins to moderate this part of the session.
Okay, I want to remind everybody, if you need to ask a question, so please put it in the Q&A section and not the chat. Okay, the first question is about vaccines. When vaccines are available, where does leadership see faculty and students who may not be in direct patient care?
So that's a good question, and I will ask Dr. Steffi Mehta to put some fine points on our response. Obviously, the first tier of individuals who will receive the vaccine will be people who are involved in direct patient contact because they are at highest risk, and also they are at risk of causing harm to patients who come here for any sort of issue. We have a team of individuals in-house who are working together to come up with how we prioritize distribution of vaccines within UAMS, keeping in mind that there may be multiple vaccines that are administered in multiple ways that may have particular benefits to certain populations within Team UAMS. Dr. Mehta, maybe you can give us an update on progress with that committee and the time frame in which we can expect to get some information back about this.
Great, thanks, Cam. It's a great question. I don't have a complete answer for you yet. The committee has yet to submit their recommendations. That should be this week. As you probably know, the CDC Advisory Committee just gave their recommendations yesterday, and our committee here is relying on the substance in that report to define our prioritization schema. So it's safe to say that if you are involved in patient care, you will be in a high priority group. If you are a faculty member and not involved in care at all, you will not fall into that category. And we'll have to see where you fall into the prioritization schema dependent on other criteria. The same goes for students. I don't know if you are a student and are directly involved in patient care where you're going to fall in the prioritization schema. So that's an important question. We'll have an answer for you hopefully by the end of this week. So as you might imagine, there are many gradations, and we might not find neatly where you as an individual fall into the prioritization schema. If there's a question about it, we'll find an answer for you. So look for publication of that prioritization plan sometime this week.
Yeah. So I appreciate the work that everybody is doing to make sure that we distribute the vaccine in a way that makes sense clinically and also that makes sense from the standpoint of risk and safety. One point that I do want to make about the vaccines is that so far we are relying on reports from the companies that have manufactured the vaccine about the safety of these vaccines, and they are telling us that these vaccines are not only effective but safe and free of substantial side effects. The safety data will be presented to the FDA, and we'll get a chance to adjudicate the safety signal ourselves, and we'll do that using science and best practices. I would encourage every member of Team UAMS to embrace a science-driven approach to ascertaining the benefits and safety of these vaccines. There's already, unfortunately, a lot of anecdotal and flat wrong information about these vaccines and about the safety of these vaccines. I heard yesterday someone said that they heard that the vaccine contains a chip that will be inserted into people that will allow individuals to be tracked. Obviously, that's crazy talk, and we're likely to hear a lot more crazy talk around the vaccines. Let's be a true north. Let's UAMS be a true north in taking a science-driven approach to evaluating the benefits and safety of these vaccines, because we all know, as Dr. Williams just pointed out very sadly but eloquently, that the alternative to deriving herd immunity through vaccines is a downward spiral.
Okay, is there a community-wide strategy for managing beds for COVID, and how is UAMS and ACH working together?
Yeah, so there are multiple tiers of collaboration that are focused on how we allocate all resources needed to take care of patients in this pandemic, both at the hospital level, the community level, and at the state level. And again, I think it bears repeating that we need resources to take care of patients with COVID-19 as those numbers increase. But as our capacity is constrained, we also need the resources to take care of patients who do not have COVID-19 and have other problems. Imagine that someone someone that you go to church with, has a stroke in a small community hospital, and they need referral to UAMS or tertiary referral centers so that they can get clot-busting drugs and state-of-the-art therapy. Well, if UAMS doesn't have a bed for that person because those beds are occupied by COVID-19, that person won't receive that state-of-the-art care. There are several things that we are doing. The hospitals in Central Arkansas meet regularly. Dr. Mehta represents us at UAMS, and we talk among ourselves about where we stand in terms of surge capacity, what resources we have. We're in regular communication. Through the Department of Emergency Management, there's distribution of resources across the state. The Hospital Association here in Arkansas, under the leadership of Bo Ryle, has done a great job of coordinating communication between hospitals and determining needs and making sure that needs are met. And as many of you may have heard, Governor Hutchinson has charged the Winter COVID-19 Task Force that he has assembled with looking into the possibility of using our trauma network, TraumaCon, as a means of moving patients around, not because of trauma, but because of COVID-19 and the consequences of the COVID-19 pandemic. So there is a lot of coordination. We're going to need that because resources may not match precisely where patient needs are, and we need to make sure that we put resources where the patients are. Dr. Mehta, anything you want to add to that?
Ken, maybe just the question about how Arkansas Children's and UMS are working together. We're working very closely together. As some of you know, we have already transferred some of our younger patients to Arkansas Children's. They have accepted younger trauma patients initially below the age of 25, now below the age of 30. Several of those patients have gone directly. We have transferred 2 20-year-old patients in our ICU to Arkansas Children's. I talked to Marcy Doder, the CEO, this morning. They are not only very pleased with the cooperation, but are asking for more patients. So that's working out pretty well.
Yeah, well, this just points to the power of the collaboration that we have between UAMS and Arkansas Children's Hospital. I know that they've also offered to provide ventilators to us if we need them. The collaboration and cooperation that we have between these organizations goes back 40 years, and this is an example of how our relationship with Arkansas Children's betters the people of the state of Arkansas.
Okay, we're going to switch topics to the dress code. Will we still be allowed to wear UAMS t-shirts daily? And what about athletic shoes?
Yes and yes, but athletic shoes do not need to be bright in color, so we ask that you not wear neon green and that sort of thing, but yes and yes.
Okay. And
so, Ms. Clark, so my son Graham has tennis shoes that squeak when he walks. Can he wear those to work?
Hopefully not on the units.
Okay, and also for the dress code, Christina, can you please again clarify if this applies to clinical, non-clinical, or both?
Both. We now have one policy to cover everyone. So you don't have to go to two locations to see where you fit in. Everyone is addressed in one dress code policy.
Okay. About the antibody treatments, can you elaborate on the antibody treatments that are now available at UAMS? What are those treatments? What is the supply, and who is eligible to receive them?
Yeah, well, that's a fast-moving topic, and it changes on a daily basis. Dr. Mehta, you want to update everybody?
Yes, thanks. Right now we have only the Eli Lilly product already mentioned. That is up and running. We have an adjudication process for making sure that the patient's or proposed patient meets the criteria set forth by the FDA. Patients are coming in through the ED. We are right now prioritizing our own staff with limited supplies. The allocation from the Department of Health is dependent on our utilization. So currently, I believe we have either 40 or 60 doses in-house. The more we use, the more we will get. There is a rather limited supply for the state, at least on the first allocation. I think it was 900 total doses. I understand that the Regeneron product is also in the state now. We'll be looking at obtaining that. The criteria for meeting the indications remain the same, at risk for severe disease and having mild to moderate symptoms as an outpatient.
Yeah, and I'd like to remind everybody that these antibodies are powerful tools for our clinicians, and they have been tested rigorously, but they're not magic bullets. And if I recall correctly, with the Eli Lilly antibody, we have to treat 20 individuals to prevent one hospitalization. So they're good tools, but they're not a reason for us to let down our guard.
Okay, a question about the travel pledge. Is it for out-of-state travel or in-state travel?
Well, think about what the purpose is. The purpose of this is to twofold. Number one is to make sure that we're not putting ourselves, our coworkers, in situations in which they're at risk. And if you're congregating with people that are not part of your nuclear family, whether that's in Texarkana or Tennessee or anywhere across the United States, that risk is real. So it's really not geographically defined. It's defined by the risk that you're putting yourself in place. And for our senior leaders, it's also to have people locally, because we may need you. You just heard what Dr. Williams said. It's going to be a dark winter for us. And whether the vaccines play out as well as they are touted to or not is not going to impact the situation here in the state of Arkansas over Christmas holidays and in the weeks beyond. So, so that's the reason why I expect the leadership at UAMS to be here in Central Arkansas over the holidays.
Okay, I am going to ask a question for Dr. Lombard-Sims, who is on this side of the room. There are departments that have been working from home during this crisis. My department has been doing so with increased productivity. Will there be departments that will permanently work from home? And if so, who or when will that information be passed along?
So yes, we have looked at the viability of certain departments being able to work permanently at home. Those decisions will be made jointly with senior leadership, obviously. In addition to looking at, the policy and making it more permanent. We had a temporary policy. We now have a work at home policy. And as long as the productivity continues the way that it has been, that is certainly something that we are considering.
Okay, thank you. All right, another question about the dress code. Does the new dress code policy override a supervisor's requirement of business attire in non-clinical or administrative areas?
No, you have to, you have to abide by your supervisor's request. So if your supervisor allows you to wear jeans, that's great. If your supervisor asks you to wear business attire, you need to follow their guidelines. It still fits within the dress code policy.
Yeah, Dr. Westphal asked me about wearing jeans to work because of the new dress code policy, and I told him that for senior leadership, wearing jeans to work is just not going to cut it.
Okay, are faculty candidates still allowed on campus for interviews, or should these interviews be Zoom only?
So that's a great question, and I think we have to do this in a prudent way. If we are recruiting people who are going to be having a big impact on this campus, it's important that we understand how well they're going to fit with the great culture that we have here at UAMS. So under limited circumstances, we do bring candidates onto campus for interviews. They want to see the place as well, and it's important for us to be able to sell UAMS to them. But the vast majority of interviews, certainly the first tier or two of interviews are now routinely happening in a virtual environment, and we may decide that we want to continue to do that in perpetuity. But for the time being, because of constraints of travel, the issues of safety, and the fact that if you've got a pool of candidates of 8 or 10, it's just not safe and difficult logistically to bring that number of people onto campus. So with prudence, and you can always talk with your HR business partner if you have questions about what is the safe and prudent thing to do, but also making sure that we are continuing to identify great talent here at UMS. And I'll editorialize a little bit about that because we do have a number of key searches throughout the organization ongoing. And there's definitely a sense that I get that because of the pandemic, I guess one of the silver linings, people are looking at places like UAMS, and especially UAMS, as being that kind of place where you can do great work, you can have a great lifestyle, and you're not at risk of the challenges that a larger urban environment will confront you with. So I think that we may see, I think we are seeing now, a better talent pool if we're looking externally for positions to be filled. And I hope that we can capture that magic and sustain it even after the pandemic is behind us.
Okay, when will a caregiver be able to accompany a patient for outpatient appointments?
I'll ask Dr. Mehta to weigh in on
that. The honest answer is I don't know yet. We were slated to start that immediately after we allow this for the inpatient accompaniment, but COVID and its increasing prevalence in our communities is giving us pause. So no one is more eager to have every patient that needs somebody to accompany them, whether it be an outpatient or inpatient visit, than I. And I say that because I seem to be getting the majority of the complaints and concerns raised, justifiably so. So I can't tell you an exact time, but I will pledge that it will be as soon as it is safe for us to do so.
Okay, we're going to end with 3 questions that combine the majority of questions that are coming through the feed right now. So back to the dress code. Wearing jeans, is that for every day, just for Fridays, or just for when you're off campus?
You can wear them every day if your supervisor allows you to with a UAMS sanctioned T-shirt.
Okay, and then one more dress code question. There are several questions coming through about the 1-inch beard policy. Can you address that a bit more in detail?
So we would like everyone to have a professional appearance, and we are a business and a hospital, and we have patients and visitors here on a regular basis, and it really does not represent UAMS in the light possible if we have scraggly, unkept beards. So we have asked that it be 1 inch. There are exceptions, especially for religious reasons, and I believe on the video there was a link to the exception area, so we will look at those as they come in.
This is, a difficult issue that we face in healthcare. And, today it may be beard, tomorrow it may be, can I wear a button reflecting certain beliefs that I have? And the day after it may be something else. But we have to keep in mind that people, usually don't come here because they choose to be here. If you're sick, you come here because you have to be here. And I think it's important that we think through the ideas of somebody who has nowhere else to go but UAMS to take care of their healthcare needs, and to make sure that we're doing everything that we can to make them feel comfortable, not to offend them, and to create a healing environment. I think that if we think about what the dress code in general means, it's to make sure that we are accommodating everybody, especially those who don't have a choice about where they seek health care and come to UAMS because they know that if no one else will take care of them, we will.
Okay, and our final question is the most popular. Will the vaccine be mandated, and will it be free?
The vaccine will probably not be mandated at first, but if you elect not to receive the vaccine, you may anticipate that if you have patient care responsibilities that you may need to be reassigned. That may change over time. We mandate the flu vaccine, and if the safety of the COVID-19 vaccine turns out to be comparable or better than the safety for the influenza vaccine, we may invoke a similar policy for the COVID-19 vaccine. But again, I think that this is a decision that we all need to make in a science-driven fashion, and not relying on misinformation and sources that are not reputable.
Okay, I think that's all.
Great. Thank you, everybody, for participating. We'll see you again at our next town hall next year. If we didn't get to your questions, we'll do our best with the marketing and communication team to provide other means to make sure that your questions are answered. And I hope all of you have a happy, but most importantly, a safe holiday this holiday season.